the disease itself called PFIC, which is a rare genetic liver disease. It stands for progressive familial intrahepatic cholestasis. 2 of my sons have this liver disease. Essentially what happens is the liver does not function as it should. Bile does not flow through the liver as it should, because anyone who has this liver disease, they're basically missing a protein enzyme that helps with the flow of bile. So in essence, over time, the liver is basically destroyed by the toxins that remain. This is a liver disease that is very, again, rare. Typically, children are diagnosed in infancy. My sons were both diagnosed at about 18 months of age. It manifests itself differently depending on the patient. For my son, my oldest, who was diagnosed 18 years ago, he'll be 20. He had a very distended abdomen, and he had a lot of itching as a baby, and we thought it was due to eczema. Looking back after his diagnosis, we would realize that is one of the most severe symptoms of PFIC and many other liver diseases. Our youngest son, who will be 12 this month, he also had very similar symptoms. And unfortunately, this disease is progressive. And over time, the liver basically develops cirrhosis, fibrosis, and typically results in transplant. The care for PFIC for my sons, and I know it does vary depending on the patient, on the child, but for my sons, they take a medicine called ursodiol, otherwise known as Actigol, and that helps with the flow of bile through the liver, but unfortunately, it's not a cure. It simply helps with some of the bile flow and some of the symptoms like the itching. I do know that doctors do certain procedures for patients to help with the itching. My sons have never had that, the medical procedure, but it is very often a symptom, which our family has had to deal with quite a bit.